I'm Dr. Haiti, and I'm here to show you around our home away from home and walk you through a day in the life as a Valley Children's resident. Before we head in, let's take in the views. As you can probably tell, Valley Children's was designed with kids in mind. Our hospital is not only bright-colored and fun, it was built with unique architecture and a low-level exterior to create a friendly and approachable environment for kids in the Central Valley. So who exactly are the kids in the Central Valley? At Valley Children's, we have the privilege of caring for children across a 45,000 square mile catchment area, from as far north as Sacramento, as far south as Bakersfield, and across the vast area of land between the Valley and the Pacific Coast. This area is home to more than 1.3 million children. Come on, let's go check it out. Hey guys, good morning. First off, the hospital is divided into different zones: earth, sky, water, and land, and they're color-coded for easy identification. Along those lines, the acute care units are named after spacecraft, and we'll get to see those shortly. Let's head over to the GME office. Oh, hey Dan.
Hey Kelly.
I gotta go check on a patient. Do you mind showing these guys around the GME office?
Yeah, no problem.
Cool.
Hey, I'm Dan. I'm one of the chief residents here along with Dr. Christina Vargas. This is our GME department. Right next to me is Jackie Green, one of our fantastic program coordinators. The program coordinators help us basically keep the program on track. So as we walk down this hallway, we will pass several different offices of our GME physician leadership. So starting with my left right here, this is the chief's office, where Dr. Christina Vargas and I sit and get all of our work done. And then right across the hall, we have Dr. Lamone's office as well. She's our designated institutional official. And then as we continue on down the hallway, we have the office of our program director, Dr. Vinny.
Hello.
And then at the very end of the hallway, we have the offices of our associate program directors, Dr. Kim and Dr. Sosa. Finally, up here on my left is one of our several GME or resident work areas / lounges. This room is actually pretty essential in resident well-being. This room is useful for not only getting some work done, but also being able to check the mailboxes, grab a snack, or grab a cup of coffee.
And now we're in the Guild's Hall of Fame. Around the hospital, you'll find artwork and statues of giraffes in honor of George, the giraffe, our mascot. Throughout the year, you can find him wandering the hallways. And on these flags, we have the 5 founding mothers of Valley Children's, a group of women who in the 1940s had a vision for creating a children's hospital for the kids in the Central Valley. The original hospital opened not far from here with 42 beds. And now, 70 years later, we have the 330-bed building we know and love today. Now let's go visit some of the inpatient units. And here we have Craycroft. This is where our patients with renal, oncologic, and endocrine diagnoses are cared for. And now over to Voyager, which is mostly a general med-surg floor. It also houses our Epilepsy Monitoring Unit, or EMU. Let's have Dr. Benke tell us about the inpatient units.
Thanks, Dr. Haiti. In general, each inpatient unit has 30 to 35 beds and 6 general inpatient units, including rehab. During the COVID-19 pandemic, we have repurposed several units to accommodate surges in these patients. Then we have Explorer, another unit for post-operative patients, but also specially equipped to handle our complex cardiology cases. All hospital rooms are private and are set up for centralized monitoring. On our floors, you'll manage a variety of obscure diagnoses as well as bread and butter pediatric cases. Health disparities are a major negative influence on children's health in the Valley. Fortunately, our team of social workers, case managers, and interpreters help us deliver exceptional, culturally and socially competent medical care. This is the Nielsen Room, which is where our ward residents get their work done. Each resident team has 1 senior and 2 interns, supervised by 1 board-certified pediatric hospitalist. We also have a day float resident service that admits patients to our teams. As an intern, you'll do 2 months of inpatient service, as well as 4 weeks of night float split into 2 blocks of 2 weeks. There is no 24-hour call, and you're pretty much guaranteed at least 1 or 2 golden weekends per month. And now we'll go visit our emergency department.
So, RED is one of the busiest in California. With over 120,000 ED visits last year, that's averaging about 300 to 400 visits a day. We have 40 beds and 2 trauma bays. It's a level 2 trauma center and is the only pediatric trauma center in the whole Central Valley. It is also the receiving area for most patients referred from community hospitals. RED is staffed with board-certified pediatric EM physicians, and because there are no fellows, we get first priority on procedures. Now, let's head downstairs and learn about the remaining inpatient units.
Welcome to the garden level of the hospital. We wouldn't be a children's hospital without the playrooms and classrooms. This is our Child Life Playroom. We are lucky to have a very supportive Child Life team that excels at relieving the stress from the hospital, and most importantly, helps kids continue to be kids. Although hospitalization can be disruptive, our teachers create individualized curricula to make sure that our patients stay on track with their schoolwork and learning in our Child Life classroom. Our garden level has 2 more of our acute units, Apollo and Discovery. With the vast pathology and large patient population at Valley Children's, we are extremely fortunate to learn from our pediatric hospitalists. Let's go check out the South Lawn where we have our large outdoor playground. We also have one of my favorite events, the Farmers Market. Every Friday, we have different vendors and food trucks.
Now let's walk back inside and check out the Rehabilitation Center. As the only pediatric rehab unit in the region, our expert team offers comprehensive inpatient and outpatient care. Our 20-bed unit is accredited by the Commission on Accreditation of Rehabilitation Facilities, or CARF, making Valley Children's one of only 2 pediatric facilities in the state with this impressive designation, and one of only 5 on the West Coast. Now let's jump and look at a few of the workrooms we have.
This is our elective rotation workroom. It's primarily used by residents who are on elective rotations. It's nice because it has a huge window, is super close to the outpatient clinics, and is only a few steps away from the infectious disease, rheumatology, and so many other clinics that we rotate through. Now let me take you all to our additional workroom. We use this for our additional 3rd and sometimes 4th ward teams. This really helps with social distancing, and it's right downstairs from the GME lounge. Another cool thing about our hospital is that it has its very own medical library. Let's see if any of the librarians are here to show us around. Hey Brian, I'm glad I caught you here. Can you tell prospective applicants a little bit about the medical library?
Hey, Dr. Gonzalez, I'd be glad to. We are open 24/7 to all residents. We have over 2,500 books and journals available both in paper and online, although the vast majority are online. We can help you with any of your scholarly requests, literature searches. We have study space behind us as well as workspace, a computer lab over here, and copying and faxing as well, whatever you need.
Thanks, Brian. The librarians are really helpful in helping me obtain journals for my scholarly projects. We really appreciate them. Let's continue and walk over to one of the most popular places in the hospital. One of the very convenient places in the hospital is our very own Starbucks. It's great anytime, but especially when our attendings on wards bring us for Starbucks rounds. But no coffee is complete without a great meal. Let's see what the cafeteria is serving today. This is the cafeteria, also known as the Grape Jellyfish Cafe. I love the hand-painted murals that make me feel like I'm underwater. There is hot food available about 22 hours per day, and we get a food stipend every quarter.
Now, welcome to the 2nd floor of the hospital, where we have the intensive care units, the operating rooms, and the procedure rooms. We have some great views of the exterior of the hospital from this floor as well. Now let's head over to the Pediatric ICU, or PICU, where we take care of some of the most critically ill children in the Central Valley. As a resident, you'll rotate through the PICU for 1 month in your 2nd and 3rd years.
On the rotation, you'll be part of a team of 3 to 4 residents and an attending, as well as pharmacists, respiratory therapists, and nursing staff. You'll have many opportunities to be first in procedures in the PICU, but you'll never be alone, as we have in-house intensivists 24/7. With 35 beds, we have a large PICU, with an additional 8 beds in our COVID unit, which is also located on this floor. Our PICU stays very busy, and in the wintertime, typically all beds in the PICU are full. We see a wide variety of pathology and have all critical care capabilities, including ECMO. In fact, our PICU was one of the few in the nation to receive the Beacon Award for Excellence in Critical Care, with mortality rates lower than national averages. How do we best prepare for what we see in the PICU? Our pediatric simulation program. Dr. Amamin will show you around.
Hi, this is Dr. Tara Lemoyne, and she is the head of our interdisciplinary simulation lab at Valley Children's. Dr. Lemoyne, can you tell us more about the program?
I sure can. Medical teams need to be prepared for anything at any time. Simulation provides us with the opportunity to train and educate in a safe learning environment. Our interprofessional simulation program uses high-fidelity mannequins to simulate common medical procedures, complex medical conditions, and emergencies. It allows our teams to practice and move their learning curve along on our mannequins and not on someone's child or loved one. It is part of our continued commitment to patient safety and improved clinical outcomes using a collaborative interprofessional education environment in a diverse and dynamic setting.
And here, named after our mascot, is Air George. Air George and our intensive care transport team provide transport for the most critically ill children in the Central Valley to bring them to our hospital as quickly as possible. By ground or air, our transport team covers over 45,000 square miles and provides over 1,200 transports per year. Residents who are interested in intensive care are able to do a rotation with the transport team. Speaking of intensive care, let's head over to the NICU next.
Welcome to the Neonatal Intensive Care Unit. Our NICU is the only Level 4 NICU in the Central Valley, which means that we have the highest quality care available. With more than 80 beds in our hospital, we take care of more than 800 infants every year. We're proud to launch a NICU fellowship in 2021. These fellows will work along with the interdisciplinary team that cares for each baby in our unit. Now that we've seen our intensive care units, let's check out one of our continuity clinics.
Right across the street from the hospital is the Medical Office Building, or MOB. Here we find the Charlie Mitchell Children's Center, the only clinic of its kind in the Central Valley. It is a federally qualified health center and provides care to children with complex medical needs regardless of the family's ability to pay. Charlie Mitchell is an option for a continuity clinic and provides a balanced experience for residents.
Hi, Dr. Nelson.
Hi, Dr. Ng. How are you?
Good. How are you?
Good.
Can you tell our guests here a little bit about the resident experience here at Charlie Mitchell?
Sure. So Charlie Mitchell Clinic is a complex medical care clinic. We take care of not only children with multiple medical issues, but we also care for their healthy siblings as well. And we enjoy having our residents as part of the team. So we're one of the main clinical sites for continuity clinic. And we really function with a team-based approach. So we have pharmacy, we have case managers, we have social work, and everybody kind of rallies together to take care of children of all abilities.
Also here in the MOB are several subspecialty clinics such as neurology, urology, pulmonology, and rehab. We also have the Walgreens pharmacy here where our inpatients can pick up their medications before being discharged home.
It's no secret that residency can be physically, mentally, and emotionally tiring. Our program is committed to promoting wellness and camaraderie through annual class-specific retreats. We also provide residents with one wellness half-day per quarter for personal health appointments, personal errands such as car maintenance, or whatever you need for your own wellness. Our program also financially supports longitudinal healthy activities. For example, backpackers or snow sport enthusiasts in need of new gear can request reimbursement via our wellness stipend, which is perfect since right here in the Central Valley we're the heart of the outdoors. The Valley offers just about every activity for the nature or exercise enthusiast. Our centralized location means you'll be just a few hours from the world's most popular vacation destinations, including Yosemite National Park, San Francisco, Monterey and Carmel, Napa Valley, Santa Barbara, and Los Angeles. We hope you've enjoyed touring Valley Children's with us. We can't wait to meet you soon.
Bye!